Please.
Minister, there's an absolute crisis going on in our health services and in your government. The Taoiseach and the Minister for Health have proved utterly incapable of resolving the various issues that are before us. Yesterday we had the GPs here outside Leinster House due to the lack of government investment in primary care. Our hospitals have the worst waiting lists right across Europe. And last month there was 10,000 patients on hospital trolleys, and last year was the worst year on record in terms of the constant trolley crisis. The debacle surrounding the National Children's Hospital is beyond farcical now, and we're no further along in it being resolved. But the issue I want to talk to you and the question I want to put to you today surrounds the issue of 37,000 nurses and midwives who have engaged in another day of industrial action, a 24-hour stoppage as a result of a complete and utter failure on your government to deal with the issue of recruitment and retention, which has gripped our health service for many, many years. I met with nurses this morning, as I've met with them on many occasions since this industrial action started late January, and their message is very clear. Their message is crystal clear to government. None of them want to be out on the picket line. All of them want to be doing what they do best, and that is caring for patients in our hospitals. Their actions aren't selfish, because they are taking their action and their stand on behalf of each and every one of us, and the people, the public, the people at home know that. That is why their actions have the support of people right across every single community in this state, because they know that nurses are fighting for a better health service for all of us. And that is at the core of it, and that is what the people understand, and that is why they are standing with the nurses and midwives in this battle. The government has, to this point, refused to engage on acceptable levels to the nurses and midwives. Earlier this week, we had the Minister for Health and the Minister for Public Expenditure issuing a joint press release saying that they were willing to engage in talks at the WRC. Engage in talks on everything bar what is at the core of this issue, which is the issue of pay. And the government has spouted that line time and time again, and that has been rejected by nurses and midwives and the INMO, and rightly so. So it is time now, Minister, and it is time for your government to get real. It is time for you, as a Cabinet colleague, along with the rest of your Cabinet colleagues, to get your heads out of the clouds and deal with this issue and this issue at hand. You say that you will engage with the nurses, but what you need to accept and what you need to act on is there is an urgent need to do that engagement without clauses and without preconditions. That approach, the approach that the government have taken so far, has failed utterly and dramatically. And let me be clear in this, and let me spell it out to every single Cabinet colleague. You and your Cabinet are putting patients at risk, because nurses never put their patients at risk. Your refusal and your intransigence to deal with this issue on a no precondition basis is putting patient safety at risk. Now, that isn't surprising given this government's record on health and the record of the Minister for Health, but within 3 days, within a number of days, we're going to have industrial action of a 3-day stoppage that is planned for next week. And what we need is proper dialogue before that. So, Minister, can I ask you, do you accept that the government's approach to tackling the recruitment and retention crisis so far has failed? Do you accept that pay is an issue and is going to need to be addressed? And will you accept that a process of engagement is needed right now without any preconditions and without any clauses?
Thank you, Deputy Minister.
Deputy. First of all, clearly, in relation to your first question, we are not there yet. Clearly, we are not there yet. And as you have identified with great eloquence, I think, the risks are escalating. I think that we understand that. And that is why there's such significant contingency planning that's going on between the INMO and also the HSE. So that's, I am fully with you and aware of that in relation to the risks that are escalating. Secondly, I would say that in my view, and I am here today as an independent minister because, yes, I am part of the government, and it is my responsibility to answer some of these questions as well. In my view, that we need something to shift in order to bring the people to the table. Yes, I think that's what needs to happen. Now, on what basis do I say that? Well, first of all, may I say, I think, first of all, there is some reasonableness on both sides. There is reasonableness in relation to, as you, again, eloquently lay out. And I have spoken with nurses as well in terms of what their concerns are, and the issue in relation to the safety of their patients are primary to them. And their understanding is that they need the issue of pay addressed in order effectively to address the issue of safety. That is what they are saying to us. On the other side, in terms of the government of which I'm a part, I think there's reasonableness in that regard as well. I came in, I was listening to, prior to that, Minister Donoghue, identifying issues relative to the pay, the collective pay agreement, and all of the other aspects of that. Those are reasonable. Those, I think, are reasonable for us as a government to lay out. And so we have reason on this side and we have reason on that side. But at the same time, we do need then something to shift in order to bring the parties together, in order to begin to have that conversation. You say, does it have to do with pay? I think Minister Donoghue has laid out, an understanding of that, but clearly, in terms of the current agreement as well as the future agreement, pay is part of that. No doubt that will be part of those discussions in terms of the safety, in terms of the condition that is required. How that is discussed, what is decided, that is determined once they get to the table. And this is, I think, the most important thing that needs to happen. The talking needs to begin, that we require significant engagement and genuine and real intensification in order to find, and that's what Minister Harris spoke about, innovative solutions that he's referred to. But in my view, and I'm sure you share this, that we need, before the significant intensification and the potential disruption that will happen next week, we need something to shift in order to get intensification in terms of engagement. And I would also say, I think this requires the support of, yes, the INMO, and also ICTU and the wider union movement.
Thank you, Minister. Deputy Doherty.
Something needs to shift. Let me put it to you, what needs to shift is the government need to indicate, and it can be done today, it can be done right here, right now, that we will enter into negotiations with the INMO on a no precondition basis. Because what the Minister, Paschal Donoghue, has said, and what Minister Harris has said, we will enter into talks, but not about pay. Now, Richard Bruton was in Morning Ireland this morning, and he said, and I quote, "I think we're prepared to talk about pay in the context of an agreement." Now, is that the position today of Cabinet, or is it the position of Minister Harris and Minister Donoghue that pay cannot be discussed? Because we do need something to shift. But the government have dug their heels in relation to this here, and they do not want to talk about what is at the core issue of this dispute. So can I ask you to give clarity, because this is leaders' questions, not ministerial questions. What is the situation of the government at this point in time? Is Minister Richard Bruton correct in his proclamation this morning, where he said that the government are willing to enter into talks to discuss pay in the context of an agreement? Or is it the old position of Minister Donoghue and Minister Harris in their press release that will talk about everything bar pay? Because this is a dispute in terms of two parties. I know which side I am on. I know which side the public are on. And I think the public believe that you are being intransigent in relation to this here. What we need is meaningful dialogue without preconditions. So can you clarify who is right or who is wrong? Or is it the case that everybody's right with their differing messages within Cabinet?
Thank you, Deputy. Minister.
Thank you, Deputy. I am aware that this is leaders' questions, first of all. Secondly, I also listened to Minister Bruton this morning, and I didn't think, in terms of the way that he was answering the question, that that is necessarily at odds with what Minister Donoghue was saying or the way in which I answered you as well. So let me explain. Indeed, as I have already said, I think in the context of and the importance of, and we are in agreement that we need a shift shortly in order to bring the parties together. And that when that happens, undoubtedly the issue of pay, whether it's in the context of what's currently has been agreed, which is going to start soon, whether it is in the context of the allowances that also have been determined in relation to the nurses, which is also going to begin, as well as undoubtedly issues, if they begin in those conversations, that no doubt issues in relation to the future are also going to be discussed. That's all, and I think that's what Minister Bruton was saying. I think Minister Donoghue would accept that if we actually get there. At the same time, identifying that there has been agreements, those agreements are beginning to be followed up with in relation to what the government has promised. So I don't think that there's a difference there. But what I am saying above all is that on the basis of our concern that we share for the safety of our patients, that both the government as well as the nurses have, that we need to come together.
Thank you, Minister. Deputy Thomas Pringle.